Welcome to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
Okay, well, I want to begin today by welcoming my guest, Kim Lewis, who is an attorney who is well-versed and well-known throughout the country for her work in the space of large class action Medicaid lawsuits and other lawsuits, quite frankly, that have a tremendous impact on system-involved youth. So the lawsuit that has taken place here in Colorado is one of many that Kim has been engaged with over her storied career. Kim, welcome to the podcast. And let's start off with having you talk about your career and what started you on this journey. Why are you doing this work? And say more about the kind of amazing work that you're doing. And I'll let you frame that up.
Well, first of all, thanks, Heidi, for having me. It's great to join you in this really important work, something that's very much a passion of mine. I would just say first a little bit about me and the work that I do and what brought me into this field really goes way back. Maybe it will date me, but I started doing my advocacy in behavioral health a long time ago in a county program in San Diego, California, where I was a patient's rights advocate and ran a patient's rights program. So I had a lot of opportunity to spend time with folks who, both children, young adults, older adults who were in the mental health system, either through being involuntarily committed to a psychiatric hospital or placed in a residential setting, maybe if it's a minor or a youth. And I got to see really firsthand and experience the impact of this work on individuals and particularly kids, where I really understood how they oftentimes were sort of a byproduct of something else going on in the world around them. And they ended up in these facilities or in the hospital because of family issues, because of foster youth involvement, a whole variety of things that I think brought kids into the system that, frankly, I think that might make you question, is this really the right place for them? And why are they here? And what do they really need that they're not getting? And so this really started for me an early point in my career in being very interested in and getting the opportunity to work directly with these kids, particularly, and get to see and understand them. And they're just amazing people, really. It got me to really think about the work that I was doing as an advocate and how to bring some dignity into their lives and some control and opportunity to have a say in their lives in a way that it seemed when I first encountered them, they really didn't have. They didn't have a lot of choice about why they were there or if they were there. And really, to me, it struck me as the behavioral health system and the mental health system really needed to be about voice and choice. And I think it always has been a very strong goal and kind of underpinning for folks with lived experience to be able to say what happens with their own life and how they can have control of it and what services or medication they take. And I think this is really critical to engaging them in the system and feeling like it's actually working for them, but also families who have youth and kids in the system to feel like they're getting what they need. I mean, they're often desperate for help. And so they're sort of looking to the system to help them. And often the system doesn't. And so I think that's the first experience and kind of understanding I got from that work. And then after being in that role, I went to a program where I got involved early in a big class action case back in 2002, actually. So the case is as old as my children. I was saying I got pregnant right around the time that case was filed, and they just graduated from college. So it shows you kind of how long these things can go. Right. But it was a big California case called KDA. And I really got an opportunity to roll up my sleeves and really get to understand both directly in LA County, where I was on the ground with a lot of experts and a lot of kids in the system, and got to see how do you rebuild a system. It was focused on foster youth at the time, but how do you get a system that actually is going to help kids, that rather than just take them out of their home and put them in a different system called foster care. And so it was an opportunity for me to really understand this area really close up in the context of a really big case, because California has obviously the most Medicaid eligible kids in the country, and particularly foster youth at the time. I mean, there were 80,000 kids statewide in foster kids. And LA County alone is the biggest foster care system in the world, really. So I got to see, what does it take to do it differently? Who do I need to know and talk to as experts to have this, to help educate me on what the opportunities were for change? And so I learned in close up, as being mentored by a lot of these experts, about what's possible. And that's what allowed me to kind of get my early experience and also get a lot of years of experience. And then I ended up coming to the National Health Law Program where I am now, and I've been here about 12 years. And to me, this was an opportunity on a more national field to be able to do what I wanted to do in California. And so using all that experience, I came into this organization, which focuses obviously on low income and underserved populations. It's a large nonprofit law office and focused on not just behavioral health, but Medicaid really, and the low income healthcare programs that we know support youth and adults who need healthcare and behavioral health services. And it's a strong entitlement program, Medicaid, in that it allows for those services to be made available in a way that no other program can. And so when I got to NHELP, I really started working on a case early in Washington State called TR, and that was kids in Medicaid trying to get home and community-based services that were more intensive to keep them successfully in their home and communities. And then I filed a number of other cases, and sort of the rest is history. And I've had cases in Washington, I have cases in New York, Louisiana, Georgia, Iowa, Colorado, Michigan. So I've gotten a lot of experience in the last 12 years being here to really be involved with a whole lot of different state efforts to make this system reform real, and successfully in states like Washington, where we had a full settlement and it was actually dismissed because they successfully implemented it, to newer places where the settlements are just underway, like Colorado, and other places where we're still in court trying to get agreement or figure out how to get through it with litigating it, which is a very daunting task to leave it to the courts to decide.
Well, and I think that's a perfect segue. I mean, the fact that you have been involved in so many states and in so many large cases, can you say more about what your feelings are about the Colorado case as you think about how it compares and contrasts with some of these other states, and how you're viewing it at this point, given that it's still very early on in its life cycle, if you will?
Well, the Colorado case came about a little differently than some of our other cases, and that's because most of our cases are what you said at the beginning, large class action lawsuits. And what that means in the federal court system, where we often litigate these federal laws, is that to be in the class, we have a definition of a class of kids, and that definition or that grouping of kids that you file a case about and you get a class certified is what drives sort of the relief or the resolution for those kids. So it's a long and drawn out process. It requires kind of a number of steps legally. And ultimately, if you have a class, when you get a settlement agreement, you need to then bring that settlement in front of the court for what's called a fairness hearing, where you open it up and you give notice to everyone who's potentially impacted, and they have an opportunity to either object to that settlement or to say how it will impact them, or to be able to support it. So it's a little more open process. In Colorado, it happens a little bit differently and happened more quickly as a result, because that long and drawn out class process takes quite a few months, even at best. And so in Colorado, it happened a little bit differently, where there was a complaint filed, and then early on that complaint got dismissed, and then we were able to quickly go into negotiation around some changes that we wanted to see in the system, and the state came to the table and we came to the table and we ironed out an agreement, and then we were able to kind of refile our complaint to have the court have what they call jurisdiction, which is an active case on their docket, to be able to oversee the settlement. So that happened really fast. By comparison with a lot of other states, I would say this one happened super quickly. It can often take years, if at all. It can take many, many years to get a settlement, depending on the state and depending on how quickly things move. But as you know, states are bureaucracies and they're very large and they don't often move quickly. So I would say in this case, Colorado moved rather fast. And I give them a credit for that, because I think they really signed up quickly and early to say, yeah, we want to do this. We want to have home and community-based services for kids. And so I'll just say substantively, the case is not a lot different than other cases we have. It's very similar in what we're seeking, which is system reform in the mental health system for kids on Medicaid who need more intensive behavioral health services to be able to stay at home, go to their schools in their community, to be successful socially and educationally, and to be able to thrive despite having the challenges of mental health diagnosis or emotional or mental health condition that may interfere, sometimes substantially with their ability to be successful. That's what this case is about, similar to many of our other settlements, in that we believe that the services that are really critical for that to be successful in the system are very specific. So we're seeking in this case what we thought in these other cases, which is intensive care coordination, which some states utilize wraparound. If you know what that is, it's a child and family team-based system where the National Wraparound Initiative driven evidence-based approach to helping serve children, especially multi-system involved children, kids who are in both, special ed, child welfare, maybe juvenile justice, as well as a mental health system. So their system involvement really gives them more challenges in that the different systems tell them to do different things. And so families get very confused early as to what they're supposed to do and how to get help. And so this process really brings together a team planning process where the child and the family are in the center, or the caregiver and the child are in the center. It could be a permanent other home that's not the parents. It could be just another legal guardian. But it puts them in the center of that process of team planning. And then it builds the system and the professionals and the informal supports that they may need, friends, family, clergy, whoever that is. And it builds that team around the family. And so that's really what I think is a critical approach to serving children in mental health, is that putting them at the center, putting the family at the center, listening to them as experts, and having them participate. And so that's a process that we call intensive care coordination through a wraparound process or through other sort of team-based process. And then secondly, it's intensive in-home services, which are both therapeutic services in the home, types of evidence-based therapies that we know work with children and families, as well as additional supports they need, like working with a mentor. The youth could be working directly with a mentor to be able to implement behavioral health changes in a community setting, like out on the soccer field or in the school, where those tensions or those behavioral issues may arise, where they're not able to handle the stress of the situation, or they're reacting to something that's bothering them in a way that's not helpful or not functional, and therefore they get kicked out of school or they get put on suspension or things like that. So it's really about helping them understand and learn a different way of reacting and responding to stressful things. And then the last piece is just mobile crisis response and stabilization. Our belief is that when you have these services, even on the best of days, there's going to be some situation where a family's going to face a crisis and they're not going to be able to handle what those behaviors are. Maybe there's something, threat to harm someone themselves, or maybe there's, breaking of property or threats against a family member, something like that can happen when things get a little bit out of hand. And so we want to have a way for that family to get that response immediately, or that youth particularly to get that response immediately by having a crisis response team come in right away and de-escalate the situation, to help everything calm down, to take a time out, to do what needs to be done to make the situation more manageable. And instead of sending the child off to the hospital or calling the police or removing the child from the home, those are all more drastic and not helpful responses for the youth, because they get a message that they're not wanted, or that the police are somehow going to intervene and know how to do this, how to deal with this problem when it's really not something they're trained to do. And so this mobile crisis response is really that process of coming to the home or into that location where the child's behavior is escalated, and then de-escalating that, and then also being around for a period of time thereafter to make sure things are working. So stabilization period thereafter. So that's what those three services are to us. They're critical, kind of three legs of the stool, I call them, to be able to stand up an intensive home and community-based service array that's going to be working for children and families in the system, no matter where they live in the state.
That's a tall undertaking, quite honestly. I mean, talking about those three anchor services, I mean, some people may hear three and feel like, oh, that doesn't seem like all that much. But when you think about the current state of affairs here in Colorado and what it takes to effectively do what you're talking about in those three areas, I think that leads me to my next question, which is, what are some of the challenges that you anticipate given your experience in other states and what you're looking at when you look at the situation here in Colorado? What are some of the things that already you're going, this is going to be maybe an obstacle, or here are some of the challenges we know already we're going to have to contend with?
Yeah, I think it's always a good question. And I think it's slightly different from place to place, but I think it's similar as well. And that is, how well is the state currently situated in their existing delivery system and their existing structure to deliver care, able to pivot and add these services or do something different than what they're doing now, which may be putting kids in institutional settings or hospitals and not having these services available on, I call them on the menu, to be able to pull from and to be able to have providers provide them when they're needed. So most states, I would say, have some, and Colorado isn't any different, have some pieces, right, that are good practice. So maybe small practices of wraparound services, maybe a statewide mobile crisis response system that with some changes could be much more effective. So there's pieces of, and maybe some in-home services or some intensive services that might be useful, but aren't really standing up at the level of intensity and the scope and with the right providers that know how to do them in a way that's going to be successful. So I think we try to pull, as in any state, from what little, what we can work from, sort of build up. It's always better if you have some successes you can build upon rather than start from scratch. So I do think that's one of the things, is what is there that can be built upon, and how is that going to, be able to be grown in a way that's going to be effective. And statewide, I think that most states have a real difficulty in these settlements getting this scope and statewide availability off the ground. It can be easy when you do a small little pilot or 10 kids here or, a little county there. But when you're talking about a statewide effort that includes all kids, regardless of whether they're in urban Denver or they're somewhere else in a much more remote part of the state, it takes a much more thought and practice and also planning to have an adequate workforce, to have adequately trained providers and make sure that they're there and they can provide timely care when it's needed. So that's oftentimes, for any state really, it's, the workforce is a major challenge. And so how that gets sort of built up and established is going to be a challenge for Colorado, like other states. But I think they are thinking about that and know that that is something that very much is in their mind as something they need to really pay attention to. And then I would say the other challenges are just getting the right people in leadership to be able to understand why we're doing this and why it's important and how it's different than traditional care or what's been done to date, or why we don't want to need to build more hospital beds instead. And that, I think, is a critical leadership piece that can be played. If people understand that in leadership, especially in behavioral health departments and other government roles, and they work together with other agencies like child welfare agencies or other parts of the government, that can be a really, really positive thing. But it takes some leadership with some real commitment. And I think I would say, just being optimistic here with Colorado, I have seen, again, very early on, I've seen that commitment of leadership, that they're really talking about things that I would hope they would be talking about. They understand the scope of how big this is. They understand there's a lot of moving parts. They very much seem committed to this goal and this effort of rolling this case out in a meaningful way. And that is a positive thing to see early on, because some states start off really just sort of in the dark and say, we don't know what to do, and we're sort of asking you to help us. They didn't need me to do that. And I'll say partly also I'm optimistic because they hired, as part of the settlement, and it's required in the settlement, a national consultant who's basically a settlement advisor. Her name is Suzanne Fields, and she's a national expert in this field of behavioral services for kids. She's helped other states stand these services. She's worked on other cases the Department of Justice has had as a subject matter expert. She understands what's required, and she understands the challenges, and they're very much relying on her and working closely with her, I think, to do this work. And so that also gives me hope, because I do know how important it is to have people who know what they're talking about and how to do it with you, and sort of helping you along the way. So I'm very excited by that. And so those are both the challenges and the positives I see kind of as to where it is today.
Well, I think it helps so much to know that there are things that have you feeling hopeful and optimistic, and recognizing that other states have had these similar challenges of ensuring the level of comprehensive services that are required can be provided in the far-flung reaches bodes well that it can be figured out here in Colorado, especially in light of the strong starting point from which we're operating, which brings me to the next question then. The state has, this next year to create its implementation plan, and then really 4 years to roll it out and have everything stand up and run well. What makes for a good implementation process, Kim? I mean, you've been through so many of these. You can speak to certainly what doesn't and point to what does. And I think, we'd be interested in hearing, how do we do this well? How can we be one of those states that stays on a very strong trajectory overall?
Yeah, it's a great question. And I think they are thinking about that very carefully. We don't obviously yet have an implementation plan, but from some of the sort of skeletal planning I've seen, they seem to have some of the, I'll just say what would I call it? Not the leaves on the trees yet, but some of the branches, at least they seem to be there for the tree to understand what it's going to take. And I'd say a really strong implementation, both plan and process, requires a staging of this effort in a way that's realistic. First, to get that leadership and initial seed money. As we know, budgets are also a major part, and legislatures are a major part of funding these efforts. So having that commitment, having that leadership that can go to the legislature and say, we need you to fund this. This is really critical. We think this is going to make a difference in the lives of kids and families in our state, and it's really important. And to be able to get that buy-in and commitment so that they can start putting down those roots into the system where they're going to have to create some foundation before they can really roll it out. And I think we're seeing that that's being done in Colorado. So I think that's a positive thing. The way that some of those sort of seedlings or those foundational pieces are really looking at what are the structural things that we need to have in place for this to get rolled out, because it's a big delivery system effort. And, so who is going to do it? Who needs to be bought into this process? What are the stakeholders that we need to engage? So I would say understanding the stages of the rollout and how to sequence them in a way that says, we're going to first have to do this piece of being clear about what we're doing. And then we have to get clear about how we're going to do it. What's the kind of structural way we're going to implement this? And then once you've got those services defined well, you've got to create some tools like assessment tools or screening tools. They're thinking about that as well to make sure that we're doing this in a consistent way across the state. with the right types of tools that are going to help us identify the right kids to get these services. So these are all kids on Medicaid with behavioral health needs. So those are the target, so to speak, of the population that's going to get these services. But there's a lot of kids, and some of them have already are in the system, and some are needing to be identified as needing behavioral health services they're not getting. So really it's creating a front door that's going to be appropriately sized and a sufficient type of tool that's going to be sensitive enough to be able to get those kids in and sort of bring them in the front door, so where they can then be identified as needing the services. So that's another kind of key feature is, what does that front door look like? How do we make sure people are using the front door appropriately and that it looks the similar size and it's easy to get through in different places in the state where you might have different regional entities that are running the system by managed care contracts, for example. But there's some consistency in the approach so that you're not just unlucky about where you live in the state or what age you happen to be. So it's really looking at that front door piece. And then the stakeholders, I'd say, process is an ongoing one. So it's at the very first outset of the case. This is a settlement. Here's what we're trying to achieve. Here are the goals. Getting buy-in as much as you can from a whole variety of stakeholders. I know that one of the key constituents is obviously going to be getting people with lived experience. And I mean, to me, that means children and families, right? Youth, former youth who've been in the system, as well as parents, former parents who've been in the system. You want those people who have the most experience with these challenges to be able to guide you on why this or this didn't work or did work. And so that to me is like a critical voice to have in the room. And I think the more you can have that at every level, so advisory at the top to the leadership table and all the way along the way regionally to get their input when you go out and you talk about this case and you're getting feedback locally. So it's not just a sort of one-time effort and it's not just on one level of the system. It's sort of built in at all levels, I think is the way I think about stakeholder input. And it's obviously members on Medicaid and their families, but it's also providers, counties, other state agencies, managed care plans and advocates. You've got to look at everyone's role and bring them all in, because when you have a lot of constituents or stakeholders undermining your efforts, it cannot be really unsuccessful. And so you've got to try to find a way to bring them along, make them believers. You make them believers by showing them that you can be successful. And I don't think they just automatically get a pass by believing you're doing the right thing because you said so. And they're going to want to see some evidence that they're being heard and listened to and that you're actually learning from what you're hearing. So that's, I think, really critical.
Yeah. And what do you see, Kim? I mean, I couldn't agree more. And, we just wrapped up these 14 statewide stakeholder sessions to ensure that we're keeping people around the table. What do you see as your role as a lead attorney on this case, as one of the lead attorneys working with the state to ensure for effective implementation? What do you see as your role in making sure that those stakeholder voices are effectively represented and captured in both the planning and actual implementation efforts?
That is a really good and hard question for somebody who, myself lives in California. While I go to Colorado and I have many friends there, I'm not there on the ground. So I'm the first one to say, I want to know how you're getting this input. I want to see what it says. I want to know who's in the room and who's not in the room. And really, for me, it's more at the stage of advice and planning rather than, being able to do some accountability on the ground as to who they've invited and why they're the right people. We do have co-counsel and other organizations that we work with, obviously, in Colorado to help us in that effort, So, the Disability Rights Program or CLP, we are very interested in getting those advocates who are there to help us partner on that effort, because I can't alone do that, regardless of my level of knowledge of what the system should include and what works nationally. I still think there's nothing that can replace local relationships. And so to me, that's critical, is who on our team can help be the hand to hold in terms of getting the right folks to be able to talk to them and also to know what their clients are experiencing, because a lot of our cases rely on a disability rights program to see, they know what's coming in the door. They're talking to families every day. So they see what's working, what's not working. And they really, to me, are critical partners to help us know, sort of canary in the coal mine, what is happening out there and whether it's working or not. So you can trust the state to do a stakeholder process, but it doesn't replace getting real information about what problems are coming in the door and whether those are actually a result of things that they need to fix and that are systemic. So that's, I don't think it's one or the other. I think it's really all of it.
Yeah.
So I will rely on folks like you and others to go and help gather that really, really critical information and for me to know what it says so that I can be raising those issues up in my role as a lead attorney in the settlement. So I can really help them think through what does that mean and to talk to the expert that's on this case about these are some of the issues we need to solve. What are your thoughts? How can you help the state in this regard address those concerns? So those are all, I think, and what's been successful elsewhere. One thing doesn't work for every state, and we all know that, but we know stakeholder processes do work. And I think the more that there's a family organization that's family run, that's not just one person working in an organization that happens to be a family member, but rather a family run organization, that can make a big difference because they have their own voice and they have their own advocacy on the ground. So that can really help other parents know there's a real partner for me out there. That's somebody that understands what I'm going through and has lived through that same experience. And so that kind of partnership is really critical to help them feel safe sharing their own experience or being able to voice their concerns.
I couldn't agree more with all of that, Kim. And I think one of the things that we have already experienced in inviting people to come to the table and begin to provide what is going to be exceedingly important feedback and that firsthand experience about here's what it says on paper, but here's how it's actually playing itself out. Some of these folks are saying, well, we've been invited to tables to have this discussion sometimes many times before. And we haven't seen change come about as a result of our engagement. And so we're not necessarily sprinting to come into this process necessarily. What would you say to people about what is it about this lawsuit and the settlement agreement that makes this somehow different than other task force efforts, for example, that have been led here in this state? Why should they think about this any differently?
It's a really important question to answer. And I would say just two things. One is this case is an externally driven change process. It's a case that was filed in federal court against the state for not doing what kids need, for not providing this critical service as we know work for kids and families in Colorado. And so we have in that way are bringing an outside sort of force and accountability to push this effort forward that otherwise might be happening in a task force driven process or maybe even a legislative one where someone, has a good idea, puts it out there, but there is no infrastructure to see how it will actually be done, or that there's no one in place to move and change it. We do have the federal court behind us, so there's some ability as plaintiffs' lawyers to be able to say, hey, this isn't working or this commitment isn't working and we're going to try to go back to court and get some kind of action. But I don't want to oversell that approach because I will say in my many years of doing this that what makes it likely to be successful is the state buy-in and the stakeholder buy-in to a belief that this life can be different as we know it, right? That we have a reason to have faith in this process, that we have a reason to believe this will be different this time. And so this is system reform work. This isn't a tweak or a tiny little change to something to try to make it slightly better. This is about really wholesale shifts of how you meet families and children and deliver services. And so that's really where the buy-in will come, is seeing that that's what we are trying to do, is to give families and kids something that they really have been asking for and what they need, and actually seeing how it's different than the usual business that they're getting or the usual small change that's coming that really doesn't make a wholesale difference in their experience. So it's that they're going to have to earn that belief, the state, and they're going to have to earn that buy-in, because if there are stakeholders who are against this, and some are in some places where they're trying to build more brick and mortar buildings or hospitals want more resources to go there, we're not necessarily saying every stakeholder is equal. Like we're not going to say, well, if they don't like it, then let's just stop doing it. We're going to say, well, what do the kids and families say? What do they need, and how is this working for them? They are the, quote, center of the system because they're who it's designed to serve. And so we can't forget that. And there's a lot more strong, vocal stakeholders who have more power, of course, because they have, lobbying arms and other ways that they get what they need. But this is really about putting children and family at the center and making sure that we are centering this change around what we know works for them, and to make sure that they are at the table all the way along the way. And we'll try to do that with both transparency of information, with data to collect and track what's happening on the ground and what the services look like and who's delivering them and where they are and to whom. And then a quality management or assurance system to make sure this change is working in the way that it was intended, to look at, what is a quality metric that we need to have in place. Hopefully it's outcome based, the kids are doing better. They're not getting expelled from schools. They're not, they're actually able to not be hospitalized and institutionalized. Those are all, to us, evidence of successes if they're avoiding those things. So those are the kinds of things that the system will have to build in to see, is this working? Our providers know how to do this in a way that's fidelity and evidence driven, and are we being successful in our efforts? And that's going to take time. That will not happen overnight. That's really an ongoing process and during this entire rollout. And much of the quality review stuff happens more towards the end, where services are actually out there and now you really are needing to measure how it's going.
I can't thank you enough for being a champion for children and family being at the center, and for saying out loud that they matter the most in this process. I think if people hear nothing else but that as the biggest takeaway from our time together, that is a huge impact. And I would hope that as this process continues to move along, that you'd be willing to come back and talk with us and give periodic updates about how you feel like things are going and what you want people to engage in around more specifically, or things that you even want to hear more from with respect to people around the state, because we want to be strong partners in this effort to make sure that we're not just creating a system on paper, but that we're really helping build and reform and create very much a working system of youth mental health care for kids in this state. So Kim, I hope you'll come back.
Yeah, I would love to come back. I strongly believe in this. My work I'm very passionate about this work. So this is my life's mission.
Well, thank you for that. I know all of us here in the state are so thrilled to have you being such a strong leader in all of this. So thanks for joining us today, and we'll look forward to talking to you again really soon.
Terrific. You take care.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.